There are some patients with Gaucher disease who go through their lives asymptomatic. But that, I think, is a minority. It's a very diverse condition. Certainly, there are children with Gaucher disease who present with growth retardation, and I think that the strategies for diagnosing those children are going to be different. They may complain of bone pain. Certainly, if we do blood counts, they will have evidence of visceral Gaucher disease, so they will have thrombocytopenia. But those children need to be diagnosed before the growth retardation has caused an irreversible change in their final height and intellectual and physical development. So I think that for children, there can be irreversible complications that can set in before the diagnosis is made. And I think if we think of those irreversible complications, they can occur in adults as well. I think another point to make is that some individuals undergo unnecessary interventions prior to the diagnosis being made. So, for example, a splenectomy is an inappropriate intervention in this day and age, and prior to intervening in that kind of a fashion, it's very important to raise awareness amongst the medical community, indeed amongst communities in general, particularly communities at risk of Gaucher disease like the Ashkenazi Jewish community, so that these individuals can be diagnosed prior to the development of an irreversible complication. These patients can present to a whole range of different specialities. In terms of Gaucher, I'll particularly mention pediatrics, hematology, but neurology, orthopedic surgery, hepatology, gastrointestinal medicine. There's a whole range of specialties that we need to cover. Type 1 Gaucher disease is something that is particularly common in the Ashkenazi Jewish community. They already have informal screening programs. Certainly they do in North London, where I work. But I think engaging with the Ashkenazi community to see what they want to do, I think that screening within communities is obviously a very sensitive area. The community is already doing a lot, but they're focusing, my impression is that they're focusing a lot on conditions like Tay-Sachs. I'm not so sure that there's that much awareness, even in the Jewish community, of Gaucher in particular. We have a working group that's had a meeting on ways of devising protocols across a range of different specialties where physicians themselves are encouraged to come up with their own ideas of how they might increase awareness, or how they might target screening at certain groups of populations. For example, individuals with abnormal blood counts, individuals with isolated splenomegaly. We could work with rheumatologists and orthopedic surgeons, for example, looking at targeted screening of those populations that show orthopedic or rheumatologic features compatible with Gaucher disease.